Hey, thanks for staying tuned on the program. Let's delve straight into it. Now, the withdrawal of U.S. funding for HIV programs, particularly through PEPFAR, has been tipped to possibly lead to a resurgence of HIV infections and age-related deaths in Nigeria, disrupting drug disbursements, impacting prevention programs, and weakening the healthcare infrastructure. Now, the immediate impact is the potential disruption of antiretroviral therapy access, as many HIV positive Nigerians rely on PEPFAR funded programs for life-saving medication. But are there options on the table, considering state governments and indeed the federal government had before now been also playing an active role in funding of these treatments? Are there genuine fears, or are governments of the federation on top of the situation would want to ask, what is the fate of persons living with HIV and who need these treatments consistently? Well, to give these enlightenments, we have in the studio with us the AXACA program manager that is. His name is Dr. Enobong Akpan. Doctor, you're welcome on Niger Delta Today.
Thank
Good to have you on the program.
Thank you.
Yeah,
good afternoon. Thank you for having me.
Okay. Well, this issue of the cut funding has been on, and so that's no longer news. But the news now is on Akwa Ibom. We understand that previous years, the survey conducted had indicated that Akwa Ibom was one of the highest when it comes to numbers of HIV positive cases in the state. And with the cut funding, let's start by understanding the impact that has had on the state's activities when it comes to HIV funding and medications, treatment, as well as even testing.
Okay, thank you so much. I'm very happy to be here, and I'm very delighted to also provide a lot of perspectives to the issue of the U.S. government funding cut. It's very true that sometime very early this year, we woke up to the fact that the U.S. President, Donald Trump, upon being elected, decided to cut the funding for HIV and other related programs to a lot of countries, not just Nigeria. Lots of countries are being affected by that funding cut. And for us in Nigeria, it was a wake-up call. It's still a wake-up call, but I'm proud to say that the agencies responsible for coordinating the HIV program, I mean the federal government through the Federal Ministry of Health and the National Agency for the Control of AIDS, NACA, had to rise up to the occasion with all the feedback, from states. Akwa Ibom was involved, and we had to, look at some mitigation measures so that our services will not be disrupted across the facilities. And I want to say with immense pride that we have done that successfully. As we speak, HIV testing services across all our health facilities are ongoing. The ARV medications are available. The only problem is that we don't know how long, but for now, we've taken stock of all the ARVs in our facilities, and they are available. It's true that we've had this information as a tsunami in the country, and in fact, it also affects us at the state level. Akwa Ibom, unfortunately, is still one of the states that is contributing very high numbers to the prevalence in the country, and so it behoves on us to rise up, and we did that with the support of our governor to ensure that we don't have gaps in the response.
Well, I was going to ask concerning the centers that we know were responsible for admitting these persons and getting them the medications that they need. To what extent are these centers still functional, especially when it comes to getting these drugs? I understand that there was is it a monthly arrangement that they come in to get those drugs? Is that still on, or are they now expected to pay a certain fee, considering it was free before now?
All right, thank you so much for that question. To put things in their proper perspective, the initial directive from the US government was a total funding cut. But after several weeks and amidst a lot of pressure, some waivers were given. And those waivers covered the areas of HIV testing services, HIV care and treatment for all populations, for pediatric and adolescent care, for PrEP. This is what we call PrEP for pregnant women. PrEP is pre-exposure prophylaxis. In fact, so there were certain areas, that had some waivers. Now, those areas are still being supported by the organizations through USAID, through PEPFAR, and with active support of the Akwa Ibom state government. Now, but there are also areas that are still affected by the funding cut short, which are areas around HIV prevention, community prevention. And by community prevention, it has a lot of thematic areas, because we'll talk about prevention in the general population, in the key population, among pregnant women, among young people. So those are the areas that are affected as we speak. Things like health system strengthening that we used to have before, things like cervical cancer management, and other issues around mental health, gender-based violence. These are the programs that are affected and are still being affected by that funding cut short. But the core issues on HIV treatment as regards drugs, as regards access to testing, as regards the availability of HIV medications are still being supported by the partners and supported by the government. Recently, the federal government, through the president, had approved some billions, and I'm sure it was carried all over the place for the purposes of also, bridging the gap in supplies of the medications. So as we speak, the government of Nigeria is also, in a way, procuring the medications, while we are still enjoying active support from the government via the waiver. So anybody that comes to tell you that the ARV medications are not available, that person is not being sincere, because we can confirm, and we do that regularly. Last week, I was in a lot of local governments to be sure that our drugs are available for our people, and it's a continuous process.
Oh, all right, Dr. Pan. The question was actually, are they expected to pay any amount to get these drugs compared to what was obtainable before now? And this waiver, does it cover PEP too? Because you mentioned PrEP. I know PEP is for post-exposure prophylaxis. Does it cover PEP too?
Okay, let me put it very clear. Nobody is expected to pay a dime to get his ARV medications. My attention and the attention of other stakeholders was brought to some information that was circulating on the media that you're having people that need to pay a certain sum of money, as high as 250,000, 500,000, and we had to, sit again and reevaluate the truth of these insinuations. Unfortunately, there is no truth at all in such in those social media rounds. Our HIV medications remain free, remain accessible, and they are all in our health facilities as we speak.
Okay, there was also the aspect where concerns were raised about some officials hoarding some of the medications, and perhaps in preparation for when they think the funding might stop completely, and then increase the price and begin sales of those medications. Has that been sorted out? Has there been plans to ensure that no medication is being hoarded?
Thank you so much. In fact, for us in Akwa Ibom, we took the issue of this funding cut very seriously, and what we did as an agency was to immediately call all the stakeholders in the response together and begin to ask all these questions. The stakeholders at the state level, at the local government level, even at the community level. We wanted to have real-time information on where these cases of hoarding or selling of medications are coming from. And from all what we've done, we've not had anybody pointing any finger at anybody or reporting an official case of hoarding. All right, and we still appeal to the community. If anybody anywhere tries to sell ARV medication or hoards the medication, please let us know. We will come to that person with the full force of the law.
Okay, and now what about alternative funding? What's the plan for the state government, SACA, to ensure that there's alternative funding so the shocker doesn't come again, and perhaps things will be properly aligned to ensure that every aspect is being covered, the PEP and PrEP, every aspect is taken care of?
Thank you so much. I want to say that even beyond as a state, at the national level, there's a document that we are developing, which is the National HIV Sustainability Framework. And at the level of NACA and the federal government, we are working on sustainability, which means that the government of the country and of states should take ownership, should lead, should fund these programs, because truth is, this assistance that is coming from the partners will not always be there. And the country has been very proactive. The only thing that has happened is that the US government's funding freeze caught everybody by surprise, and then that means we had to, expedite the HIV sustainability process. For us in Akwa Ibom, we have inaugurated what we call the State Domestic Resource Mobilization Committee. That was inaugurated by the government through the State Ministry of Health, and that committee is ably led by a former Speaker of the Akwa Ibom State House of Assembly, Right Honorable Sam Ikon. That committee has members cut across all the spheres of the state, both the private sector and the public sector. And the mandate of that committee is to help us in SACA to begin to generate funding to support our programs. I want to also say that the government of the day, ably led by our governor, Pastor Omo Basieno, is completely aware of the situation and has begun to give us support. We are beginning to enjoy some support from the government, and I want to assure you that more will come. When you've had a program that was over 90% supported by the organization, by partners over the years, you don't just expect that the counterpart funding will just come like that, but gradually we are enjoying the support, and we can say that it can only get better.
All right, let's talk about the awareness creation as made possible by AXACA. Now, with this announcement by the US, I'm sure a lot of disruptions took place, and possibly persons who were used to a certain location, which may have shut down as a result of this, may have had issues with finding where they could, alternative places they could go to for medications and attention. What is the awareness creation like, and what has AXACA been doing since this announcement in ensuring that persons who may suffer glitches of any nature are sorted out?
Okay, thank you so much. I think I'm very delighted to answer that question, because as an agency with the mandate of coordination and leading of the entire HIV response in Akwa Ibom State, just like you have in other states and at the national level, immediately we got wind of this funding cut, we had to activate our stakeholders and the community structures. The initial information we got was that some health facilities were locked up, and some clients, some recipients of care could not access their medications. But immediately we heard that we had to go in and ensure that even though for some weeks the partners were not working, that the health facilities were open and the drugs were available for our clients. That was the immediate thing we did, because it's very bad, it's very painful for someone who is due for his drug refill to go to where he usually takes his medications, and upon arriving there, he's being told that the place is locked, there are no keys to get medication, there is no documentation for it. So we had to make sure that that never happened. So we deployed our team, and I want to thank the stakeholders from the State Ministry of Health and the HIV unit who has been with us, has partnered with us, and we've discussed also with the general hospitals, with the medical superintendents. We've had discussions with the primary healthcare directors across the states, telling them that, come, you don't need to close your doors. The hospitals are all open as we speak. And that's the success story. We are monitoring the situation wherever we have a reduction in supply of either test kits or medications. We move in and make sure that our people get those drugs.
Well, is it the same attention paid to some areas, especially those in urban areas, that the same attention is being given to rural and hard-to-reach areas?
Yeah, exactly. We have some peculiar challenges with the hard-to-reach areas, and that is why we call for support, because there are a lot of logistic challenges for us to overcome when you talk of the hard-to-reach areas, the riverine areas of Mbo, Isnobolo, Ibno. There are some coastal areas that pose some challenge, but we will overcome it. We are actively working with the partners. Thank God they are back. Most of the partners are back for now, working with us, and we are still working together to see how we can drive accessibility to make sure we don't leave any part of the state behind.
All right. Well, Jenny, okay, I'll just take this question because your task is about control of AIDS, and it begs the question, what has been the momentum for AXACA when it comes to actually controlling AIDS spread in Akwa Ibom State? I mean, we know that Akwa Ibom is still pegged as the highest when it comes to prevalence of HIV in Nigeria. Is it about 5.5% or thereabout? But then we want to know, has there been some very serious work that has gone into ensuring that Akwa Ibom, makes it a little bit lower than what we are or where we are currently?
All right, thank you so much. The data that shows that Akwa Ibom is the highest in the country is the NICE survey data of 2018. And since then, I make bold to say that a lot of work has gone into reducing the prevalence, preventing new infections, increasing the awareness across all the thematic areas. And the thematic areas are much. The general population, the key population, the young people, the adolescents, the pregnant women, the role of the TBS, lots of it. And that has gone on over the years. Thankfully, by the special grace of God and by some of the moves that we made, Akwa Ibom State was selected as the first state to benefit from another survey. We called it the AIS, the ART Impact Survey, which was done last year. And that was like the NICE survey of 2018 that will now also assess the impact of all the work that has been done since 2018. So last year we had that 2024 and the AIS survey, and as we speak, we are expecting the results of the AIS survey after the data collection and other aspects of the survey have been concluded. What we know is that there has been an increased awareness, and we've been very strategic in our approach towards awareness creation, because HIV response is not just a health issue. HIV is also a social issue, it's a cultural issue, it's a religious issue. There are so many factors that affect the response. That is why the agency does not only work with the Ministry of Health. We work with the Ministry of Education to assess our young people in the secondary schools, and the universities. Just a few weeks ago, we did a mental health program in 3 selected universities in the state. We also work with the Ministry of Women Affairs and Children, to make sure that the young people, we have a lot of young HIV positive children whose parents died or whose parents left the children, you know, and it's our honors to make sure that those young children are taken care of. So across the program, we are doing a lot of community level engagement. Just last year, we had stakeholders around the religious leaders, around the traditional leaders in each of the senatorial districts to ensure that we now propagate this message to all of them who we consider as the community gatekeepers, who are opinion leaders in their spheres of influence, who will be able to, you know, join us, partner with us to carry this message. So the agency is working with a wide range of stakeholders, and for us, if we get it right at the community level, especially now that we have a governor who is very passionate about the health sector, especially in the rural areas, we are keying into the vision of His Excellency the Governor via the Arise agenda on rural development. And rural development includes rural health, and you cannot be healthy if you don't have the right information. So we are trying to penetrate our communities as much as we can to ensure that all our community structures are well informed, and a well-informed state is a healthy state.
Okay, well, just recently, the Akwa Ibom State had domesticated the anti-stigma law, and we've been looking forward to understanding what AXACA is doing in ensuring or addressing issues of stigma, especially in the state.
Thank you so much. Let me tell you that it's even SACA that has been at the forefront of ensuring that that law was passed by the Akwa Ibom State House of Assembly. When I came in, I understood that there were efforts before to have that law passed. It was passed, but not assented to by the then governor. But so he had to go through the process again. What we enjoyed at SACA is the goodwill and support of the leadership of the Akwa Ibom State House of Assembly, led by Right Honorable Demantong, who himself spearheaded the effort then as House Committee Chairman on Health. And when he became Speaker, he just, you know, continued with that same level of passion. You know, himself and the present Chairman House Committee on Health, Right Honorable Moses Essien, were very instrumental working with us to ensure that the anti-stigma bill received such expedite, attention at the House of Assembly, and it has been passed. And I also want to inform us that this time it's richer compared to how it was, because we've received a lot more input into the law. The law, as we speak, is at the table of the governor, waiting his assent.
So
I'm
what
sure
are you doing
that
to ensure
we are pulling all the strings. We are still working with the House of Assembly. We are working with people around the governor, and the governor understands that a stigma is one of the key issues that affects the HIV response in Akwa Ibom State. And in no distant time, I'm very confident that the governor will grant his assent to the anti-stigma law.
Okay, well, let's just get a bit of what you hope should take place in the coming few days, in the coming few weeks, or what you expect people to do, or individuals or organizations to do to ensure that HIV treatment, testing will continue to be free in the States. What are you calling for? What are you looking forward to seeing?
Oh, thank you so much for that question. Very recently, our agency, SACA, just finished work on a document, and we call that document the Akwa Ibom State Prevention Plan, because the funding cut from the U.S. government has ensured that they cannot support any prevention program anymore in all the states and countries going forward. So as government, as private sector, it behoves on us to fill in the gap around prevention. There are still people, believe you me, even in the urban centers, who still do not believe that HIV is real, and who do not also believe in those different risk factors to contracting HIV. So we are working around that. We are also calling partners, private sectors. The funding for HIV is not a funding that the government alone can carry. That's the truth of the matter. When we just recently we called for the cost of testing kits, and when we had the cost, and then we now calculated how much we need as a state, per month to sustain the HIV testing services, it runs into millions and millions, So I'm calling on private sectors. I'm calling on corporate bodies. I'm calling for every good and well-meaning citizen of Akwa Ibom that loves Akwa Ibom. And I know of a lot of people that have come to me and told me, we want to support you to work on this HIV program because I lost my uncle, I lost my mother, I lost my relative of mine from HIV/AIDS. So government cannot do it alone, clearly. So we need the active collaboration of the private sector and other corporate organizations. Thank you.
Thank you very much. We must thank you, AXACA Program Manager, Dr. Enobomapan, for making out time to speak with us, Niger Delta Today. We hope that the efforts that is being made towards the control of AIDS will continue to yield the much needed positives. Thank you for coming on the program.
Thank you.
Thank you
for having me.
Thank you. We appreciate your time.
All right, we'll take a breather. And when we return, we'll turn our sights on the issues of fuel price hike in the nation and how it is affecting the Niger Delta region. Just stay tuned.